Welcome to this week's Today's Health and Wellness Podcast. This is Brett.
And I'm Ashley. The Today's Health and Wellness Podcast is a joint effort of the Central Ohio Health and Wellness Magazine and Today's Health.
In each week's podcast, we spotlight health and wellness stories you'll find in the magazine, on Today's Health web pages and social media, as well as extras you'll only hear in the weekly podcasts.
Thanks for subscribing and hitting the play button. Let's get started. Brett, you had the opportunity to talk with Michelle Glauser, the marketing director at Capital Healthcare Network, for the podcast. They offer a wide variety of services that includes physical, occupational, and speech therapy, as well as one of the region's best independent living villas and assisted living facilities.
You bet. You know, most people don't know that the patient can choose where to go to get their physical therapy done. Michelle covers that and some great tips on how to talk to your mom and dad about when it's time to leave home and look at independent or assisted living. Let's get started. Ashley, Today's Health and Wellness's Mark Noose recently spoke with Dr. Butler from Innovative Dental Ideas.
That's right. Dr. Butler has been practicing dentistry in our community here in Columbus for 30 years. He is trained in 22 different implant systems and has also trained other dentists in many implant platforms. Mark talked with Dr. Butler about longevity dentistry for mature patients. Let's hear what the doctor had to say.
Hi, this is Mark Noose. Thanks for joining us today. We're talking with Dr. James Butler about longevity dentistry. Dentistry for a lifetime and planning ahead for that lifetime. Dr. Butler, tell us exactly what is longevity dentistry?
Well, Mark, longevity dentistry is the art and science of discovering what the needs of each individual are so that we can set them up with a system, both a way of fixing the teeth and a way of maintaining the teeth so that they minimize their long-term problems, their long-term susceptibility to further disease. That's the first goal. Second goal is to make sure that we use materials and methods that are compatible with their lifestyle and with their genetics so that they can not have breakdowns once they get into retirement.
And what's the difference between maintaining your current dental health and reconstructive dentistry?
Reconstructive dentistry is we practice what's called bioaesthetic. Now, what that means is that if it's biologically correct, it also looks good, okay? And so what we're trying to do is return you to a state of biological balance where you have enough back teeth to support the bite and the front teeth are located so that you can chew properly and the smile looks good. But we're using materials and methods that can be long-lasting and also can have an easy preventive curve, meaning it's not too hard to take care of. So the right plan long-term is evaluating all those things and then step by step improving the oral conditions until they're maintainable, they're aesthetic, meaning they look good, and they're also strong enough to last.
And we're talking with Dr. James Butler. And tell us, what are some of the advantages of reconstructive surgery and reconstructive dentistry to the patient?
Well, we call, temporary dentistry is what we call patch and spackle dentistry, and sometimes that's all you have time for. But when you plan out a more well thought out plan, it may take a year or two or three to achieve, but you're usually using longer lasting materials, better looking materials, and things that fit together better, okay? So what we're talking about is having a plan of action to go through and help you get the kind of bite and smile that you want and do it in a lasting fashion. So it's the planning aspect is the critical thing. Having a lot of different choices in as far as, for example, the implant systems, we actually use only about 5 of those technologies, and they fit different situations because a front tooth is as different as a back tooth as a car tire is to a bicycle tire, and you really shouldn't limit yourself to one system of restoring people's mouths with implants. Many people need implants and don't end up getting them either through lack of ability to ask the right questions or lack of going to people who use implants as their primary care modality. But right now it's well accepted that dental implants is the cornerstone of long-term health for most people.
Dr. Butler, how do the implants fit in with a person's existing teeth?
Well, a lot of people, there's 104 million Americans who have lost at least one tooth. And if you've lost one tooth and you have a bridge, you're limiting yourself to a 20-year function cycle, and plus the teeth that are supporting the bridge end up torn up, and then you have a 3-tooth problem later. So many people that are in bridge work now that plan for that wearing out and then get the implant put in instead, not only do they double the strength of that area, but they also save the adjacent teeth. So having a plan to transition from bridge work to dental implants is a really smart thing to do. And that's some of the stuff that is out there. I mean, almost everybody needs a dental implant at some point in their life, except for the 5% or so of the population that never loses a tooth.
We're talking today with Dr. James Butler. And how do the implants fit in with patients' insurance plans?
Yeah, well, it turns out that the modern simplified systems that we use cover about 3/4 of the implants, and some of those are covered now. A lot of insurances are more progressive. They don't always have the right amount of money set aside, because remember their main thrust is maintenance and having a filling here and there or a crown. But implants and bridge work aren't that different in cost now when you have a simple situation. Now, some people who have injuries or big infections need more reconstructive things done, and that's well known. But the average cost of doing an average dental implant is very similar to bridge work. So now the choices are very easy to make, especially when you're using the systems that we use to simplify the process and speed it up.
And if people have questions about reconstructive or longevity dentistry, how can you help them out?
Well, I'll tell you this, Mark. I committed to the free dental consultation when I first listed myself as an implant dentist and went into longevity dentistry back in 2004. So for the last 13 years, we have given free dental consultations, okay? And that can be a screening x-ray and a consultation regarding what you feel that your needs are and what are your aspirations for what you're trying to get done. And then we can share with you the technology available to help you and some of the ways that you can map it out, both lifestyle and financially. Obviously, if dental insurance isn't covering everything, we have to have financial options for people to make payments and things. But that free consultation introduces you to the comprehensive care aspect of what we do and allows you to have better choice than just going in and someone finds a cavity and fills it, and really we're not really looking down the road at what we can do to get in the way of failures, because it's a lot cheaper to transition something as you see it wear out than to wait for it to break and then come in as an urgent care client, because that is more costly and you get less long-term benefit.
And finally, Dr. Butler, people are living longer, and not only are they living longer, they're healthier for a longer period of time, and they expect a better quality of life. So how does longevity dentistry fit into a long-term plan for a better life?
Well, it turns out that most financial planners estimate that if you have a 20 to 25-year retirement period, that your cost of medicine is almost $200,000 as part of your planning. Well, it turns out that the dental portion of that is the most controllable and most expected of all those costs if you have a dentist that knows what they're looking at when you're 40 to 60 years old. So you can choose the materials and methods that have the longevity that you need, and you can transition into things that will last so that you can avoid having your dental health just crash and burn at, say, 75 with no money set aside to take care of it. So that preventive aspect. Also, Johns Hopkins says that dental implants, rather than partials, dentures, or dental bridge work, is number 4 on the top 10 list of things that you can do for your health after the age of 65. So it's well known that dental health is indicative of your quality of life in retirement. So that's why we do that pre-retirement longevity planning.
And Jim, thanks so much. Dr. James Butler has been our guest on the program today. I'm Mark Noose. Thanks so very much for listening.
Thanks again for listening to this week's Today's Health and Wellness podcast, brought to you by Central Ohio Health and Wellness Magazine and Today's Health. If you have a health and wellness segment you would like us to cover, send us an email. Our contact information is in the show notes.
And if you'd like more information about sponsoring our podcast, like Ashley just mentioned, our contact information is in the podcast notes. We look forward to hearing from you.
Circle 270 Media Podcast Network.
This is Tracy from the Traveling Through the Middle Ages podcast. Travel is my passion, my obsession, my way of life. And since I adore these life-altering experiences, it has become my personal mission to help others achieve their own bucket list of memories. From eco-lodges and whitewater rafting in Costa Rica to laid-back all-inclusives in Mexico and the Caribbean, from our great national parks in the United States, as well as genteel British castles and river cruising on the Rhine. My goal is to make every individual's travel wish come true. With over 25 years of experience in the travel industry, I look forward to sharing my travel experiences with you to help you with your future travel destinations. Are you ready for traveling through the Middle Ages? Find out more about my Traveling Through the Middle Ages podcast at travelswithtracy.com.